We are delighted to announce the publication of the new Planned Homebirths in Ireland audit report with findings from the year 2021. This report offers an informative resource that can be used by clinicians to inform women. The report can also be used for women themselves to be self-informed in a clear and transparent manner in relation to planned home birth as an option in Ireland. The audit examines both the maternal and infant outcomes of planned HSE home births, including outcomes whereby the care of the woman is transferred for hospital care during her pregnancy, labor, or after the birth of the baby. When a woman inquires about having a home birth, she can contact a designated midwifery officer or the community midwife in her area, or book directly with one of the hospitals providing an integrated community service. The criteria for home birth is discussed with the woman. If the woman is then deemed suitable for the service and she wishes to continue, an application form and consent form are signed between the community midwife and the woman. This is forwarded to the designated midwifery officer or manager of the service to confirm eligibility. Some women may require an individual assessment by a consultant obstetrician. Women are advised to register with a general practitioner and to register and avail of services with a maternity hospital of their choice. The community midwife will be the primary carer for the mother and child up to 2 weeks after the birth, subject to individual needs. In 2021, 0.4% of all births registered in Ireland occurred at home. There were 429 women who registered for a home birth, with 248 women giving birth at home. The number of women seeking a home birth is gradually increasing since 2017. When looking at the distance of the women's residence to the maternity unit, we observed that the average distance was 26 kilometers. This distance is important because sometimes, women who have planned to give birth at home are required to have their care transferred to a maternity hospital due to different reasons. These transfers can occur during pregnancy, labor, or after the birth of the baby. In 2021, approximately 1 in 3 women required a transfer to hospital during their pregnancy. This represents 126 of the 429 women who were registered for a home birth. The most common reason for this transfer happening during pregnancy was that the women were going past their due date. Of the 303 women who began laboring at home, 18% were transferred to a maternity hospital. Most of these transfers occurred during the first stage of labor and took an average time of 33 minutes. The most common reason women went to hospital during their labor was for further pain relief options, such as an epidural. Women having their first baby were more likely to transfer during their pregnancy or labor compared to women who have had a previous birth. On average, the women received 5 home visits from the community midwife after the birth of the baby. On the day of the home birth, 96% of women were breastfeeding exclusively, with 96% breastfeeding exclusively on the day of discharge. Women who birthed at home were twice as likely to be breastfeeding exclusively on day of discharge compared to all women who gave birth. These were the main findings of the latest Planned Homebirths in Ireland audit report. To learn more about the audit or any other of our audits, please do not hesitate to contact us and visit our website or our social media channels on Instagram, Twitter and LinkedIn.